Hello, everyone. It's Jason again with the Alternative Mobile Services Association. Today I'm with Alexander Heaton, and he is with the Policing Project. Welcome, Alexander.
Thanks a lot for having me today.
You have written a we're going to get into it, evaluation on Minneapolis. But let me ask first, tell us a little bit about you and how did you get into this line of work?
Sure. So I'm the director of Reimagining Public Safety here at the NYU Policing Project at the NYU School of Law. I came here from the city of Chicago, where I was a policy advisor for public safety with a focus on arrest alternatives and police alternatives. And then prior to that, I was at the University of Chicago Crime and Education Labs, where again, I focused on designing and implementing arrest alternative programming that would eventually be evaluated by on some of our economists that worked with us. Prior to that, I was really in the international sector, focusing on economic development as a violence reduction tool and kind of a conflict management tool.
So deep in the policy arena.
That's it. Very deep in it.
And tell us about the New York University Policing Project.
Sure. So the policing project is it's a project that sits, as I said, within the School of Law at NYU, and we really focus on kind of a few broad topics. So the first one is what we're talking about today is reimagining public safety. So that's working with cities to think through how they create public safety in their city outside of, traditionally through law enforcement, fire, EMS, things like that. Also, through like model legislation, so looking at ways that we can use legislation to make our creation of safety a more just and democratic process. Um, Advocating for additional women in law enforcement through what's called the 30 by 30 initiative, which hopes to have 30% women in law enforcement by 2030 as a means to make interactions between law enforcement and the community safer. And then finally, we have technology, looking at how technology is used in policing, proposing regulations for it around things that could make sure that, we still respect people's rights while we use all these technological innovations to kind of help with, police work, police investigations. And then the very final thing is litigation. So that's specific lawsuits that again, try and make the kind of investigation and police work more just and confronts and makes it kind of really more democratic.
Oh, so fascinating. So many parts and pieces. But this is not just teaching law. This is quite a bit outside of that teaching law framework.
Yeah, so this is a project that exists under Professor Barry Friedman, who really did some of the first like in-depth research into kind of like looking at the function of the creation of safety in municipalities and really thinking through like how this is done and asking questions like, why are the police responsible for all of these things? A lot of like tasks where the police officer's role is really to intervene in a public health concern or task, like car accidents, where the police's role is primarily to write a report on behalf of insurance companies. And so Professor Friedman really asked these questions that led to this project of it's like, okay, well, let's go out there and see is there another way that we can still address people's concerns in the community, but maybe take some of these responsibilities away from the police so that we can have them focus on the things that we really want them to focus on, which is, like violence reduction.
Yeah, this is not reducing the police. This is just putting them to the use that they're actually trained to do.
Absolutely. It's like we want the police to be able to focus on the thing that they do the best out of all of these. And, we don't send the fire department in to investigate a homicide. This is similar. We want to kind of move some of these responsibilities out of police so they have more opportunity to focus on these things that they are specifically trained for.
Right? We don't expect mobile crisis workers to be closing cases.
Exactly.
Yeah. Well, so you have written, just to jump ahead, you have written the Minneapolis Community Safety Ecosystem Asset and Gap Analysis. with the findings and action plan attached to this. You put this out in December of 2024. Uh, just walk us through this gap analysis. What have you done here?
Sure. So the gap analysis and an action plan is really in it basically builds off of what was done previously by Dr. Oftelli of Harvard, where it was called the Minnesota Safe and Thriving Communities Report and
Okay.
Plan. And what this did was this built out kind of a way to view community safety in the city of Minneapolis. And so what we did was using that as a lens. We then came in and kind of brought it a bit closer to the ground. So we interviewed, the city sent out a questionnaire to a number of partners, both city partners and city contractors, even some county partners. And then we came in for kind of follow-on conversations with all of them, where we really asked them kind of, what is your role in creating safety? What are some of your reach goals? What are some of the barriers here? What are some of the barriers out in the community that stop you from being able to be as successful as you'd like to be? And then, excuse me, and then finish with some asks of like, what would you need to be more effective? And then, yeah, we spoke to quite a few organizations, and then we came back and using again the Safe and Thriving Communities Report as a kind of lens, we bucketed those into various categories, and then we also came up with recommendations for how to address some of these concerns that came up. And that is kind of the basis for the asset and gaps analysis and an action plan that we wrote.
And so, how did you find the Minneapolis community safety process at this point? What's the status of that?
Well, I think first and foremost, like it's happening. It's going on. It's not. It's like the thing that we were really excited about was that they are doing this. They're doing the work already.
Hmm.
And so that's the big thing that we saw here is that there's a lot of programs in the city that they are excited about doing the work. They have the blessing of the city to kind of really go forth and do this. We just found opportunities for them to either expand their footprint or maybe geography time wise, or expand what they're doing in terms of like theme, types of calls, types of concerns they respond to. And then the big kind of overlying recommendation that we had was really like looking at how all of these different programs fit into a larger ecosystem and how that ecosystem is managed.
Tell us about some of these initiatives the city is undertaking to improve their community safety.
Yeah, so the city has behavioral crisis response already, and that's a contracted entity that responds to a number of calls that have a mental health behavioral crisis component to them. So that's already up and running. It's going well. I think like our recommendation was to expand the number of units that were there, and even expand the call types that you're sending in. Again, with the goal of allowing our police officers and firefighters to kind of focus on things other than that. They've got a really exciting follow-up program that exists in the city. They use county health workers to embed in the police stations, and these folks are able to follow up on calls that police officers may have interacted with previously. Again, with the goal of reducing the likelihood of future calls for service and future interactions with the law. Some really exciting kind of programs they have based out of the schools. They've got a really interesting schools clinics program, which is we're excited to see kind of who ends up evaluating that to see what the results are. But I do think like it's really promising. You're getting a ton of kids having contact with healthcare professionals, and that's something that research has shown has the possibility of reducing mental health concerns, reducing child suicide, things like this that could be really promising. And so, and on top of that, there's a number of other things that, great arrest diversion programs. We've got a really exciting gun arrest diversion program, which initial evaluations have shown to be effective at reducing future contacts with the criminal justice system. So I think what I'm trying to get at is the city has a bunch of really exciting programs that exist already there that are doing really promising work in the field.
And this is an extension of the work that you mentioned, Dr. Say his name again for me.
Dr. Oftelli?
Yeah, that he had begun a few years ago.
He did, yeah. So he came in a few years ago and really thought about how the city should think through the creation of safety more so than just a response to a 911 call. It's really thinking about like how do we stop concerns from rising to the level of 911 call. Once they've risen to the level of 911 call, how do we address them in a means that they don't result in follow-on calls in the future? And then afterwards, if we look at are folks who have experienced trauma or have experienced, some sort of challenge. Like, how do we build the capacity of those folks to address that trauma in a way that's healthy and resolves their concerns?
So it starts with someone, a knowledgeable person coming in and taking a holistic look at the continuum of community safety, not just the patchwork, let's fix it in reaction to some event, some critical incident.
Right, exactly. And we're trying to get away from the whack-a-mole idea and really think through an ecosystem of safety that includes, housing, jobs, healthcare, responses to calls in a manner that sends the most appropriate response, and really manages those as an ecosystem.
And this is usually the provenance of a police commissioner or a police chief. I imagine there's a lot of people involved with this.
Well, I wouldn't say it's usually the police chief. It really falls under the mayor's office, right? So like all of these happen together. Public health is out there interacting with folks experiencing homelessness or folks experiencing substance use disorder or mental health concerns. Also, the police interact with these folks as well. Fire department interacts with these folks as well. There's a significant population of students who are experiencing those same things. And so this every agency that's outward facing really touches this. And so this is what we wanted to get at here is like we want to bring in all of these agencies to say like, we have the city community health mission or community safety mission, excuse me. And this is how we envision everybody working together to get us there.
Well, this is very reassuring, the idea that everyone can work together towards a common goal, because that's not the case in most cities.
No, I mean this is what we're really kind of working towards is that Minneapolis has a great start on creating a community safety ecosystem, and we're trying to support them as they kind of build it out into something, build out the governance of that so that it really becomes even more effective than it already is.
Let's dig in on a couple of those initiatives. You mentioned mobile crisis. Of course, that's our interest. And I assume you're speaking of Canopy Roots.
No. Oh, yeah. Sorry. Camp Roots is sorry.
Good.
I was talking to a different city this morning, and I was like, wait.
Canopy Roots.
That's it.
Tell us about we've heard the story on the street is that Canopy Roots is making it happen in Minneapolis, but you are an independent assessor of this. What do you think?
Yeah, the community likes them. The city likes them. Like going out and we spoke to folks out in the community about them. They've had nothing but positive things to say.
Really?
The only response is like we want to see more of them. We want to see more take on more of these calls and more of these roles. It was a really positive interaction. That was really it was a wholesome feedback that we got. That I think in this field you don't always hear when you're speaking about safety.
Not at all. Not at all. That's very encouraging. And did you mention some community violence intervention? Is that active also in Minneapolis?
It is, yeah. So there's a lot of community. There's your traditional violence interrupters, your group violence intervention workers. This is happening, in the schools. It's happening in the hospitals. So there's really great coverage of this that we saw, and we were just advocating for it to continue to widen the coverage and make sure that you'll see in the report that we want to make sure that like the time that they're available is reflective of the time that all of these violent incidences are happening.
And something I hadn't really heard of is public health outreach workers working with the police department to go out and follow up calls. Explain that a little
Yeah.
bit more. Unpack that.
So there's a number of ways that it works. Basically, you've got embedded social workers are in the police station, and these are folks who come from the county's behavioral health unit. And so these folks are trying to make contact with individuals that the police department have frequent contact with, in the hopes that they can, again, get these folks into service, get them into the county's like follow-up and outreach program, so they can address any of these underlying causes of them having this kind of frequent contact with the law.
So that's Hennepin County, and this is another interesting development of this story is that you've got a county and a city working together towards the same ends.
Yeah, it's interesting in that the county does the majority of the behavioral health work using public staff in the area. So you've got Hennepin County provides that sort of the healthcare side, and the city obviously is focusing on like has the policing and fire. EMS is county as well.
Hmm.
So it's kind of a mix of service providers in that space.
So now you've issued the report. It's getting some traction in the city. Tell us about its reception.
I mean, it was great. It was like it was. We went in. City council was really pleased with it. I think the city was really pleased that they were doing a lot already and that they're moving forward. I think the thing that we're the most excited about is the city has committed to shifting 20% of their calls over to the expanded response kind of uh, portfolio for lack of a better term. So
Mhm.
whether this be, you're expanding the BCR calls, which is Canopy Roots, expanding the calls that are going to embedded social workers, expanding maybe like having a calls being diverted within the 911 call center that don't necessarily require a response. And so they're really excited about this, and that's the thing that you need. You need to have an executive office that is excited about doing this, that's willing to hold all of their agencies accountable to moving forward for these goals. And the city has that, which is, half the battle.
Very envious of Minneapolis. So what's next in the timeline? Where does it go from here?
Yeah, so next timeline is that, we've given the city these kind of like action items that they can do to really address some of the challenges that came up that we identified through the asset and gaps analysis. So the city's going to identify what they can do in-house. They're going to see if there's ways that like we can support them through our office of addressing some of these action items. And then I imagine there's going to be some that they may have to go to the county or to other providers to help with as well. If you look through the report, the first 25 pages or so
Hmm.
are the action items themselves, if you want to look through what those are. And so that they range from, what we consider kind of like quick turnaround fixes to things that are going to require longer and more thought out changes.
Well, I read through this. I found it was very helpful in doing just that, in reading it myself and then thinking about the cities that I know about and saying, okay, well, this city X is way ahead on this item, but way behind on that item. I was able to sort of get an idea about how other cities could be helped by reading your document. So it's really not just about Minneapolis.
No, it's about a way to think these things through. So I think like what we want folks to see is that like, everybody is doing something, a little bit of something. And this is
Mhm.
becoming so widespread now that like you can look to your peer cities and see, like cities in North Carolina, Wilmington are doing really great work with traffic. Minneapolis is about to do amazing, they are currently doing amazing work with traffic. We've recommended they expand that, but their work with traffic is really exciting as well. I think and so as you go through this and you look at like who's doing great online reporting, City of Dallas is doing amazing stuff with their online reporting.
Hmm.
It's really about speaking to other municipalities and seeing who's done what where, what can I take bits and pieces from as we build this ideal community safety ecosystem, recognizing that it's going to have a little different flavors for each region of the country that you're doing it in, but in reality, like this sort of stuff can be done. And it's not, none of this, no municipality needs to think that they're doing this for the first time. In reality, what they're doing is they're taking bits and pieces of other cities that have already done it.
And I don't want to skip over the inspiration for at least some of this has to come from the murder of George Floyd.
Absolutely. I mean, all eyes on Minneapolis here and to kind of really, to do something. And I think that they've really taken concrete steps towards doing that. This is something that the community has asked for, and they've really been responsive to.
Well, thanks, Alex. Thanks for your work. Thanks for this great report. We'll have the link below this video, so when you're reading your newsletter or online, you can read the report as well.
Thanks for chatting with me today. I really appreciate it.
Take care.
Have a good one.